Despite a global decline in female genital mutilation, the World Health Organization has raised concerns over the increasing number of cases being carried out by healthcare professionals. The National Agency for the Control of AIDS has called for inclusive and supportive workplaces for everyone, including people living with HIV or affected by HIV. Good day, viewers. Welcome back to DDM Health News Updates on our program. Your host, The Worlds. As usual, friends, I often remind you guys to subscribe to our YouTube channel, that is Diaspora Digital Media, to get the latest on health. Your health is always your wealth. So what do I have today? Well, the Osun State government on Wednesday said it has commenced medical procedures on those pupils in public primary and secondary schools in the state found to be having serious eye defects. Wow. This was disclosed on Wednesday by Executive Secretary, Osun Health Insurance Agency, Rasik Akindele, at the concluding section of the two-day first quarter providers forum and training on basic emergency care to OSHA accredited providers held in Osogbo, Osun State. OSHA, that is the Osun State Health Insurance Agency. Go. Well, the DDM had previously reported that 345,000 public primary and secondary school pupils were screened for eye-related challenges under the state-funded initiative called Imole School Eye Health Program, with over 42,000 of them getting free treatments, including free glasses. Oh my goodness. Well, giving an update during an interview on the sidelines of the Providers Forum, Akindele, whose agency is handling the project of the state government, said medical procedures had commenced on the critical cases identified among the pupils, adding that the surgeries were being done in batches. So they have, let's say, batch 1 and batch 2. So some of the pupils were not performing well because of the visual challenges they had. So we got the approval of the governor to screen all the students in public primary and secondary schools. Wonderful. Wow. We screened over 345,000 students. And we discovered that about 45,000 of them had eye challenges. Oh my goodness. 42,000 of them have refractive errors, which were corrected by giving corrective glasses. Some of them get drugs that will make their vision better, and some of them needed surgery. Oh my goodness. 45,000 pupils. We have started those who needed surgery in series, and we have not concluded. When we conclude, we will let the people know the outcome. Yes, we can't wait for the outcome of this. Wow. The governor has also promised that we are going to extend the gesture to the private schools so that they can also benefit. That was what Akindele said. He further said teachers in public schools would also be screened, having discovered that some of them also have visual impairment during the screening of the pupils. Yeah, because some of them are old women, especially in public areas, or public schools rather. So speaking at the training, the OSHA boss said the platform had made it possible for healthcare providers partnering with the government and the health insurance scheme to bring forward their complaints with a view to getting them addressed by the appropriate authority. He also said the training had provided an avenue for the government to look into the level of compliance with condition of engagement it's set for the healthcare providers and check if the terms were being complied with. Wow. So the last time we had a forum like this, we saw the impacts on the field. Enrollees expressed satisfaction with what they saw or what they got when they went to the hospitals. So we are expecting a better impact this time around on the enrollees. Okay, next. World Health Organization has called on the states in Nigeria to increase immunization funding to boost access to life-saving vaccines. Okay? While decrying the decline in immunization coverage across Africa in the wake of COVID-19 pandemic, the Global Health Organization stressed the need for urgent action to close what it termed widening immunity gaps. Acting WHO Regional Director for Africa, Dr. Chikwe Ihekwazu, stated this in his message to mark the flag off of the African Vaccination Week 2025 with the theme, Immunization for All is Humanly Possible, held at the Model Primary Health Care Center, Rumibo Obiakpo Local Government Area of Rivers State. Ihekwazu said immunization is not only one of the most effective public health tools, but a fundamental right, a shared responsibility, and also a vital investment in our future. I believe that also. He stated, vaccines have saved an estimated 154 million lives over the past 50 years, reducing infant mortality by 40% and protecting people from more than 30 deadly diseases. Of course, yes, diseases like polio, cholera, and so many others, even measles. In 2024, the global community celebrated 50 years of the expanded program on immunization. This milestone was a reminder of the extraordinary progress made and the work that remains. Okay? Dr. Ihekwazu, however, said despite the advances, many people in Africa still lack access to essential vaccines. So sad. Saying 1 in 5 children in Africa remain under-vaccinated. Gosh. The World Health Organization official continued. In 2023 alone, 6.7 million children received no vaccines at all, so-called zero-dose children. Hey! Measles outbreaks persist while vaccine-derived poliovirus continues to pose a threat. He said the theme for 2025 is a powerful call to action as it affirms that together we can reach every last child, strengthen health systems, restore and expand routine immunization services disrupted by the COVID-19 pandemic. Okay? I think that's a very strong theme. He further said this year also marks the midway point of Immunization Agenda 2030, that is the IA 2030, a global commitment to achieving equitable vaccine access by 2030, saying, now is the time to accelerate progress, expand coverage, and close immunity gaps. WHO and partners are working closely with countries to identify and reach zero-dosing children, integrate immunization into primary health care, and build stronger, more resilient health systems. In February 2025, a high-level side event co-hosted by WHO, the African Union Commission, the government of Sierra Leone, Africa Center for Disease Control and Prevention, Gavi, the Vaccine Alliance, and UNICEF reviewed progress since the 2017 Addis Declaration on Immunization. Well, Ihekwazu noted that the meeting celebrated growing political commitment and system improvements, but also acknowledged challenges such as financing gaps, inequities, and weak data systems. It concluded as a strong call to action to make immunization a top priority across Africa's health and development agendas. Of course, to sustain and build on this progress, I call on governments to increase domestic investment and secure sustainable immunization financing, health systems to integrate vaccines into essential services and expand access, communities to stand against misinformation and vaccine hesitancy, global partners to continue supporting equitable vaccine access across Africa. Remember, not just Nigeria alone, but Africa as a whole. The WHO, he said, remains steadfast in its support to river states, working together to ensure that immunization for all is not just a goal, but a reality, saying, let us turn commitment into action. Of course, action speaks louder. So, vaccinated communities are healthier communities, and no one should be left behind. Not at all. No one should be left behind. Everyone needs to be vaccinated. Following that, the National Agency for the Control of AIDS has called for inclusive and supportive workplaces for everyone, including people living with HIV or affected by HIV. NACA made the call in a statement signed by its Director General, Dr. Temitokwe Ilori, on Tuesday to commemorate the 2025 International Workers' Day. Wow. Ilori said, as the world marks International Workers' Day, we honor the contributors of workers everywhere and reaffirm our commitment to creating inclusive, supportive workplaces for all, including those living in with or affected by HIV. Yes, let's not keep them aside. Workplaces are more than sites of labor, they are communities. On this day, we call on employers, unions, and government bodies to champion HIV awareness, education, and zero discrimination policies in the workplace. But it's not gonna be easy, of course, when you know that your co-worker is affected with HIV. Definitely. Well, with almost 2 million people living with HIV in Nigeria, many are part of our workforce, yes, contributing every day while facing the double burden of health challenges and societal stigma. We must ensure that HIV is never a barrier to employment, dignity, or opportunity. Okay? As we build fair and safe work environments, let us remember that health rights are human rights. Together, we can create a world where every worker, regardless of their HIV status, is treated with respect, fairness, and care. I believe that too. Data obtained from NACA show that out of the over 2 million people living with HIV in Nigeria, 1,753,425 of them know their HIV status. This includes 1,693,457 adults and 579,209 males, and also 1,114,401 females, and 54,983 children aged 0 to 14 years. Meanwhile, access to treatment has expanded significantly, with 1,735,808 HIV currently on antiretroviral therapy. These include 1,690,507 adults and 577,632 males, and also 1,112,425 females and 45,751 children aged 0 to 14 who accessed ARTS. Out of those on treatment, 1,160,256 individuals were tested for viral suppression, and 1,112,339 were confirmed to have a suppressed viral load. Oh, so sad. These groups include 183,177 adults and 363,531 males, and also 719,645 females, with a conclusion of 29,163 children. God have mercy. People across the world honestly are living with HIV. Finally, despite a global decline in female genital mutilation, the World Health Organization has raised concerns over the increasing number of cases being carried out by healthcare professionals. In a statement published on Monday to mark the renewed fight against the practice, the WHO warned that 1 in our 4 FGM producers globally is now performed by healthcare workers, a situation it's described as deeply troubling. It further noted that although the health sector globally played a key role in stopping the practice of FGM and supporting the survivors, evidence suggested the contrary. According to the UN agency, as of 2020, an estimated 52 million women and girls had undergone FGM at the hands of medical personnel. Commenting on the matter, the World Health Organization's Director for Sexual and Reproductive Health and Research, Dr. Pascal Alote, said, health workers must be agents for change rather than perpetrators of this harmful practice. She described the acts as a severe violation of girls' rights that puts their health at serious risk. The health agency stated that while evidence showed that FGM causes harm, regardless of the person performing it, it was more dangerous when performed by a health worker, as the medicalized procedure resulted in severe wounds. Oh my goodness. To address the challenge, WHO issued new guidelines urging governments, medical professionals, and communities to take stronger action. Yes, I think this could help. Although the global rate of FGM has declined significantly since 1990, the practice remains widespread in 30 countries, and Nigeria is included, where an estimated 4 million girls remain at risk each year. The WHO said the harmful practice, which involves partial or total removal of external female genital for non-medical reasons, has both immediate and long-term health consequences. Yes, it does. This includes psychological trauma, increased risks of childbirth complications, and also, in some cases, the need for reconstructive surgery. Research cited by the WHO showed that health professionals can play a crucial role in ending the practice by challenging community norms and educating families. Always have it in mind, education is the best. That is why we often remind you guys to subscribe to our YouTube channel so that you get the latest on what to do. Yes, because also a senior author of the study at scientists at WHO and the Human Reproduction Program, Christiana Palito, noted engaging doctors, nurses, and midwives should be a key element in FGM prevention and response as countries seek to end and practice and also to protect the health of women and girls. The health agency noted that several African countries have made commendable progress. Countries such as Burkina Faso, for instance, has cut FGM rates among girls aged 15 to 19 by half in the last 30 years, while Sierra Leone and Ethiopia have also recorded sharp declines of FGM. In 2022, WHO lauded a specialized training package for frontline health workers to help them sensitively address FGM within communities and promote prevention strategies that respect cultural context. I am now able to raise women's awareness and persuade them about the disadvantages, a health worker trained under the initiative said during its rollout. So please, when all these things are going out in the community, don't forget to reach to the nearby hospital to report of such. With this, friends, this will be all for now on Your Health, Your Wealth. Be sure to like, share, subscribe, and comment to our YouTube channel, Diaspora Digital Media, for more latest health news updates. Until I come your way next time, I remain Nenero Michael Nidini. Thanks for watching. Bye for now.